So we've been talking here with our group on resiliency as part of a restorative practice. And so I brought up the first slide here, and we've been talking about various ways we all cope with the virus. And we've also been talking about ways that we cope in our lives when things get from just a little disappointment all the way up to overwhelming stress. And definitely some of the things we've talked about are self-care. And when I think about self-care, I think about the various ways we take care of ourselves, and I think of them as a baseline. So it's like basically you can't pour from an empty cup, so you have to take care of yourself first. So you can't really be helping your family or helping yourself or anything if you're on empty. And so self-care is like the preventative way of dealing with stress. It's like ahead of time. And you can use the same techniques when you're stressed or when after a stress and needing to recover. But self-care is like the baseline. And so we talk about trauma as having an amount and stress about having an amount of tolerance. So you have so much tolerance and that baseline can be a little higher or a little lower, so you can have less tolerance or more tolerance. And if you do good self-care and take care of yourself, your feelings kind of resourced, you have enough food, you have good nutrition, your living situation is comfortable, you've handled all of the different physical needs you have, and just using those self-care strategies for managing your physical, emotional, intellectual, and spiritual needs. So I like to also call that as being resourced. And part of that is looking at needs, because this is nonviolent communication. I like to look at them as actually a hierarchy, like Maslow talked about, hierarchy of needs, with the physiological needs, of course, being at the base. So you have your air, water, food, shelter, sleep, clothing, all those things are right at the bottom. And then as you can satisfy those, then you're able to help your second level needs, which are like the safety needs. And then once safety is kind of met, then you can look at your love and belonging needs, and then work up to your self-esteem needs, and then work up to self-actualization needs. I mean, they're not exactly piled one on top of another, but it's definitely true that if you're hungry, you don't really care about self-actualization. And if safety is not met, you certainly don't care so much about esteem needs and love as much as just being safe. So I think they do have a hierarchy, and I think it's useful to look at them that way as well. And so we've talked about self-care. The second thing we could talk about is somatic intelligence. And somatic intelligence are the physical things you've learned that you can do to relieve stress, that include, of course, a lot of the things you've talked about, like meditation, excuse me, like exercise, like breathing, and actions that you can do to calm your body. So there's things you do in prevention which can then be used when you're under stress. And remembering, of course, the flight, the reaction that is the fight, flight, flee reaction when we're in stress, how to calm from that moment when your body's adrenalized, when your nervous system is charged, and using some of the self-care techniques to help your body, using your somatic intelligence, using what your body knows to do and what you've been training it to do during your self-care. And then we can add emotional intelligence. So when we have emotional intelligence, then we also are aware of our emotions, like we were talking about before when I was talking about how I will dissociate from my emotions and not feel as a way of coping. And having that self-awareness of what I'm doing, or having more self-awareness of my emotions, may actually help me to cope better. Then I can learn to regulate them instead of just suppressing them and pushing them aside. So that may be a better way to work on myself, and that is kind of the whole field of social and emotional intelligence, where we develop self-awareness, we develop self-regulation, empathy, and social skills as well. So those are another ways, moving up to emotional issues, that we can help ourselves become more resilient during a stressful time and afterwards to recover from stress. And we're talking about acute stress, of course, and chronic stress. This is an EQ ruler that Mark Brackett of Yale put out, Professor Mark Brackett. So there's different ways we need to actually look at emotions, recognizing them, understanding them, labeling them, expressing them, and then regulating them. So that's kind of his way. We can use this sort of EQ ruler in the schools and with ourselves. So if we understand how to use that to recognize and understand our own emotions, label them, express them, and then regulate them. So these are all elements of teaching emotional intelligence that we can use for ourselves, and of course, when in teaching others how to have more emotional intelligence. And this is what we've talked about in the past as well, but again, to recognize that there are kind of 4 elements in social emotional learning, and they are developmental. So first we learn some self-awareness. I mean, when you're really little, you think the whole world is just what you see, and you don't understand you're separate from the world when you're a baby. And then you slowly learn self-awareness, and then you learn to regulate your emotions and understand how you are in the world with yourself. And then you begin to realize, oh, there's another world out there, and become socially aware, and then work on actually developing and balancing the needs of self and the needs of others, which is called having and being in relationship. So that's sort of the full gamut of social and emotional learning from that developmental cascade, if you like. Another element in resiliency is our mental or thoughts and intellect. And one of the big things is learning how to problem solve. And for me as a physician, I definitely learned how to do that, because it's about how do you solve a problem? Well, someone comes to you with an illness. Well, first you have to figure out how to make the diagnosis. And once you've figured out that, you have to analyze the causes of the unwanted situation would be the first sort of step. And then you generate a differential diagnosis, which means many possible diagnoses as it could be. And then we do tests like MRIs or X-rays or blood tests, or whatever, to figure out which one it is, evaluate the best possible diagnosis, and then come up with a treatment plan, solutions, a treatment plan, and then begin to implement it. So sometimes you're not completely sure, you'll try a medication and it doesn't work. And so you have to test the hypothesis that you've created that was the diagnosis. So that's about problem solving medically, and it's related to how people can learn to problem solve in general. And another skill that we can teach the kids who we are being exposed to in the schools, teach them how to problem solve, how to use their mind, and also the mind and the intellect, the intelligence, about giving them data about what resilience is. Give them data about our trauma-informed aspects. So what is stress, and how do you express your stress? How do you express your emotions? So there's an aspect of intelligence, of using our cortex to understand that. So we can use our brain and our thoughts to make us more resilient. And then to me, that all of those are kind of, I feel like they're baseline stuff, things that we can teach, basic self-care, somatic intelligence or body awareness, emotional intelligence, social emotional intelligence, and our mental intellect. All of those are things that are more a little bit more concrete. The more difficult way is, how do we teach beliefs that can support people in their resilience? For me, the way I'm most resilient, I think, is that I believe that there's meaning in everything, and that everything has a purpose. So that's kind of the mindset I have, and the belief that I can always learn, that I can figure my way out of things, that things are going to go all right, that it's going to work out. These are beliefs, and that's a little bit harder to figure out how to teach kids that, and to teach the mindset, the optimism, and meaning. Okay, so I'm going to just stop sharing for a minute, and then we're going to do a little poll, and then we'll continue. Pause. Okay, so we just took a poll, and that had mixed results with mixed answers, as was sort of expected, but the poll was mainly meant to talk about whether or not someone inside themselves believes that their intelligence is fixed for life, and that their personality is fixed for life, or things can change. That's called mindset, which is one of the aspects of beliefs we have. Mindset, and there's optimism and meaning. So let's talk a little bit about mindset. So it's Carol Dweck's work on mindset. She wrote a book called Mindset, and there's a fixed mindset and there's a growth mindset. And the interesting thing is that for me, for my younger life, for sure, I was pretty sure that I was intelligent, and that's the way it would always be, and that I was a certain kind of person, and that I wasn't musical or very mathematical, and that's the way it would always be. And we were also taught in medical school 30 plus years ago that your brain didn't change, that you couldn't, that basically old dogs can't learn new tricks. That if someone has a stroke or a neurological injury, that the brain doesn't grow, and that we don't make new neural connections after we reach brain maturity at age 25. And so that results in the whole concept of a fixed mindset. And so that was basically not only belief I had psychologically about myself, it was also a belief that the medical establishment was believing. And so I think our society held more of that belief, and it's what a lot of us grew up with. But as we learn more about the world, we learned that the brain actually can grow and change. We can therefore change our IQ, we can change our personality, and we can heal and form new neural connections at any age. And the truth that if you stop using it, you lose it is true. And the more you use it, the more you learn, and the more new neural connections are made. So you can actually learn from feedback and have a growth mindset. And it's a new way of looking at the world. And that's the whole field of neuroplasticity, which is defined as the growing and withering of neural connections with usage. And this was something that Grace Dearborn likes to teach by using action mirroring to remember the definition. So she would do a little dance, which I think Hawkeye has witnessed in person in the past, about the growing and withering of neural connections, make a connection with usage. So you can make like 4 symbols for growing, withering, neural connections, and usage to help kids and adults remember. You make a little sort of mirroring sort of hand dance, if you like. Anyway, it's that's sort of an aside as to how to learn, but the important thing is about neuroplasticity. And so the question is, what does a resilient person look like? And this is definitely, for me, when I think of Paralympics and Paralympians, that is definitely to me, underscores resilience. Someone coming back, this person took the gold in this particular event in 2012, and she's got cerebral palsy and her legs don't work. And here she is on a bicycle winning. You know, it's Hannah Cockcroft. So, you know, that's like, when I think about it, what does a resilient person look like? And so what makes, you know, this person do this when another person stays at home, eats too much, gets fat, gets pressure sores, and dies at an early age because they are not taking care of themselves. So that's sort of the whole idea of potentially mindset that someone believes doesn't, you know, and it's about belief. You know, we've talked about self-care, somatic intelligence, emotional intelligence, knowledge, beliefs, and social supports is the other thing we haven't talked about. So social supports, of course, the organizations, your friends you have, your family, and the church and social organizations, social services, agencies that can help. And what we're tasked with is teaching resilience. And we can teach kids to do self-care, I believe. We can teach them somatic intelligence. We can teach them emotional intelligence. Teaching NVC is all about teaching emotional intelligence and teaching about, you know, feelings and needs and making requests and you know, when no is really a yes. All of these things are emotional intelligence. And we can teach them about mindset as well, that there is something called a growth mindset, which is a different way of framing the world that can help their behavior. But it's a little harder to teach the beliefs, but I think we can instill and teach kids uh, that the world has, that I see the world as meaning, and they can, and model that, and talk about how we cope as a way of helping them to cope. So I think that's the way the teaching, because you can only teach what you know. You can only teach what you are, in fact. So modeling is a really, really important part about teaching optimism, teaching mindset, and teaching the person how you see meaning in life, how you contribute, and how you show up. And what's in the way of teaching? Well, we definitely know that the the concept of trauma informed, and the fact that there are ACEs, adverse childhood experiences, that stands for, that have traumatized people when they're young, gets in the way of any kind of teaching. And the other thing I've recognized when I was reading today about it is that this is the probability of outcomes if you've got some of these ACE, which are basically measures of whether or not you were exposed to violence as a child, or where you were abused, or your parent was in jail, or your parent was a drug addict. And there's a list of 10 of them. It's a little study that was done. It's been done all over the world now, showing that it does create worse outcomes. So if you have no ACEs, those are your risks. And then on the far side, if you have 7+ ACEs, that's sort of the risks. But I, after reading today, realized we can look at that a different way. So if you look at someone in the bottom there who has 7+ ACEs, 1 in 5 of those people will attempt suicide. So that's 20% risk, very high risk compared to 1 in 96. And that also says that even though these people have all of these major traumatic experiences as a child, only 1 in 5 attempt suicide. So in other words, you can look at it from the half full cup, which 80% of the people with that terrible history do well and are resilient despite this. And so what do those people do? How did they learn to become resilient? And I think it's what we've been talking about are some of the ways we can help people to be resilient. But even without help, these people find ways to be resilient. And that's about the whole concept of benevolent factors. So there is a list of those, which I don't have up here, but they're studying that. And so if a person has one loving, caring adult in their life over time, then their chance of having those ACEs show up in their life, having the increased risk, having drug addiction, having alcoholism, having heart disease, having a shortened lifespan, all those things are way less. So that there are factors that exist in people's lives that countermand these ACEs, and recognize again that most of the people, even with these really bad ACE scores, do well. It's still a very high number that don't do well, and that's higher than we ever thought, and that's important, but it's also important to recognize that the majority of them do well, even if they have very high risk. And one of the things we talk about now in trauma-informed care is universal precautions. So in medicine, there's universal precautions to prevent infectious disease, which we're all experiencing how those are enacted in the world right now, as we're all using universal precautions by social distancing, washing our hands, wearing masks, recognizing that infections can be spread. But we can also do that for everybody else in the world to deal with the fact there's a lot of trauma in the world. And the nice thing about that is it really helps normal people too, who haven't been traumatized, to have routines, to eliminate loud noises and sudden changes that might be triggering to anyone, to have consent for physical touch, to have a loving and nurturing environment, to focus on relationships, and to have collaboration and consequences, not punishment. So these are universally good for everyone. So we're saying and asking people to adopt these in the schools as a point of view, as universal precautions. Okay, thank you so much. I'm going to stop sharing the slideshow and we'll have a little discussion about that.